You have a storied career with numerous accomplishments, recognitions, and awards. How did your journey as a world-class oculoplastic surgeon begin?
My father was one of the pioneers in lens implant surgery in pediatric glaucomas. So I grew up around ophthalmology, and he was the first ophthalmologist in Canada to actually implant a lens in the eye after cataract surgery back in 1965. And so I was around these world-class cataract surgeons. I used to run the projector at his meetings, and I met some of the giants in ophthalmology back when I was a teenager. I knew that I wanted to become an ophthalmologist, and it wasn't until my second year of residency when I met two professors, Dr. Spohr and Dr. Nisi, who specialized in oculoplastic surgery, and I found this aspect of ophthalmology fascinating and applied and was accepted for a fellowship after my residency with Dr. Spohr and Nisi to do neuro-ophthalmology and oculoplastic and orbital surgery, which was one of the most rewarding years of my training, and that's really how it began.
Was there a specific point during your medical training that you decided to work in the cosmetic and reconstructive eyelid field?
Yes, it was when I met Dr. Spohr and Dr. Nisi, and that was really the turning point. Up until then, I really hadn't considered oculoplastic surgery.
You have been practicing in Tampa since 1991. Where does your medical practice service area extend to?
Really, all over the United States, we've had patients from Canada, we've had some patients from Europe. It just depends on, if they need my area of expertise and they've heard of me and they've heard that I've get pretty good results. And so it's really all over the world, mostly obviously in Florida, United States and Canada, but from other places all around the world as well.
Your medical field involves various disciplines. Can you briefly discuss the scope of the conditions that your medical field involves?
Well, a lot of generalized medical conditions affect the eye: diabetes, thyroid eye disease, neurologic problems can affect various aspects of what we do. Skin cancers, melanoma, metastatic cancers affect orbital disease. All kinds of autoimmune diseases can affect the eyelids and orbits. Certainly, as I said before, thyroid has a huge effect on the eye. Diabetes, a huge effect on the eye, both from a retina point standpoint and also causing double vision, cranial nerve palsies, and the like. Neurologic conditions also obviously affect the eye, considering that the visual pathways go through the brain. So the entire body can affect the eyes, and some people say that the eyes are the window to the body. We can look at the eyes and get a lot of hints as to whether or not there are other medical conditions going on, from diabetes to high blood pressure to thyroid disease to neurologic conditions to autoimmune diseases.
Can a condition that you treat lead to other medical conditions if left untreated?
Well, yes, as we went through earlier, thyroid, diabetes, high blood pressure, these are just to name a few of the conditions that we treat that can cause serious problems throughout the body.
What has it meant to you personally to be entrusted by so many people throughout the years to provide medical treatment that has helped improve the lives of so many?
Well, I mean, there's no greater reward than a patient after we treat them, whether it's fix their eyelids, whether we reconstruct from cancer, whether we restore vision. When they're grateful, some of them even give me hugs, and you can't put a value on something like that. It's priceless when we're able to help people and they appreciate it. I mean, that's really why we all went into medicine.
For those that do not immediately recognize that they have an eyelid or orbital medical condition, what are some of the symptoms they should be mindful of?
Well, I mean, the big things are that we worry about are cancer, obviously, eyelid cancers, orbital cancers. If anything's not right, such as pain, discomfort, decreased vision, double vision, redness, irritation, too much tearing, if there's anything out of the ordinary, it always helps to, go get it screened. You can go to your optometrist if that's nearby or your ophthalmologist. And if they pick up something that needs to be seen by a specialist, they'll refer to someone like me and we can go from there. But anything that's out of the ordinary that doesn't get better, I always tell patients, if it's not getting better, you need to check it out. That's a simple rule of thumb for anything.